Hello everyone, happy Thursday, and this is Dr. Gurung with another episode of To Talk Thursday. Well, I'm at a different site today location, so this is the office and the welcome area. This is my reception at it's going to be my logo wall, and thanks for helping me out selecting those my logo, like the design, so thanks. So today I'm back with another episode to Talk Thursday. I know I'm doing it after some time, so yeah, just bear with me. So if you guys can share where you guys are watching me from, that would be nice, and so that I can say hi. Yeah, so just talking a little bit about our practice. We are a brand new dental office here in the heart of Queens, New York, 8710 Jackson Heights, 8710 Northern Boulevard, Jackson Heights, New York. So we're located on the second floor, 204, Suite 204. And today, I know, just giving you guys a little update on the construction. The painting is done, the flooring is done. So it's very exciting to see all the amazing things happening here at the practice. At the same time, I did not realize that there's so many detailed things that, you know, need so much attention and so much of, you know, like a lot of like paperwork at the same time. And again, like, you know, you have to be very, very, you know, it's like, you know, little, like in dentistry, like millimeters and a tiny bit of measurement counts, like that, like here in while building the practice too, like every bit of you know, the detailed, accurate measurement, the color, the shades, it matters. So I'm very, like, you know, I'm very happy to do all this. At the same time, it's very you know, it's interesting at the same time, very like time consuming too. So hopefully we should be get our practice up and running very soon. I know we have some inspection coming up, so yeah, that's all about our practice for now. I know. So the topic today is what would you do, like if you have a tooth missing, or what happens when you end up losing tooth. So I would like to talk a little bit about that. Just giving you a scenario, like you can lose tooth. There can be a lot of factors when you lose, like, you know, the reason that you lose tooth. So number one can be if you have cavity or caries that you cannot you know, treat, and then it goes down into the root end and the tooth kind of loses a lot of tooth structure, so it's not healthy enough to support the crown or anything on top or filling on top. So in that case, the tooth needs to get extracted. The other scenario can be there can be a possible trauma, like any injury to the tooth that you cannot restore it, so that's when the tooth can be extracted, like pulled as well. Sometimes the teeth are congenitally missing, so like the lower first premolars, those lateral incisors, those are like an area people usually the permanent teeth are missing. The third option can be if you get a lot of infection the root end of it, like you cannot treat it by regular root canal and it continues to hurt. They tend to, you know, people tend to, we need to extract those teeth as well. And sometimes you don't have a good bone, and then that's called a periodontal condition, periodontal, like it's called periodontitis. So if it's severe enough, then if the bone cannot hold the teeth, like that's when the tooth needs to be extracted as well. So yeah, thanks for tuning in, guys. Yeah. So today I would like to talk about like a replacement option for missing teeth, like a single tooth. So let me just share this picture here where, I mean, this, so I have this model here with, you know, a missing side, a tooth. So it can be one of your cases, like I've had that issue too. So yeah, so once a tooth is extracted, what happens is there's like a little socket left here, right? So eventually bone fills in. At the same time, you'll tend to lose a lot of bone around it. So not just, so the bone loss happens vertically, that means it tends to shrink downward and it tends to be thin. So if you do not do anything about it, what happens is you eventually lose a lot of bone, and after a certain time, this won't be good enough for holding any kind of restoration in the restoration later. So the standard of care these days is what is called implant. So talking a little bit about implants, these are titanium or like zirconia screw that screws into the bone, and then once it's screwed in the bone, it screws in the bone like this, and it so will allow it to integrate, like osseointegrate. That means the bone has to integrate with the implant, and the process is called osseointegration. So once that integration happens, let's say for lower, it's about 3 to 4 months for the mandible, and for the maxilla, it takes about 4 to 6 months, just because of the varying like density and the quality of the bone in the arch. So once this is screwed in, we allow it to integrate, and then after a few months, we'll go in there and put these like channels. These are called abutments. So we just have to take impression and screw these abutments in there. And once it's screwed in, so this gives you a nice base for the crown, the implant crown to go in. So this is how the implant crown goes in, right? So we just sometimes glue it, sometimes screw it. So there are various options available, and we just, it's case by case. So this is what it looks like if you have an implanted tooth, and this is like a cross section. So as you can see, so this is one tooth, and if you replace that, so what happens, the good thing about implant is it tends to hold the bone in place, and it'll allow those bone to reach, like, to be in place, and it prevents the surrounding area from losing bone. Second good thing is you do not compromise the tooth in the front of it and back of it. So you do not take support from the tooth in front of it and back of it. So that's another advantage. You're just working if you just need one replacement. You don't have to worry about cutting the other one in the front and back of it. The third option is the strength. It has a chewing efficiency as much as the natural teeth, and again, it's more of like ankylosed into the bone, so it's nice and nicely supported. So you do not have to worry about having it like losing it or something, like unlike the other kind of restoration. So this is what an implant, single tooth implant restoration looks like. And the other options can be, if you're losing like multiple, there can be like two different, you can have like two screws in place, and then you can put a bridge in place. So this is called implant supported bridge. If you're doing like 2, 3, it's gonna be, if sometimes you can, if you're losing a whole implant, like tooth in the entire arch, I can get like multiple implants and place like a denture on top, so implant supported denture, or implant supported like a full fixed hybrid restoration as well. So that's a little bit about implant. So what happens if you are not a good candidate for implant, or the finances doesn't allow it, right? So there are still other options available, and it can be, so it is called a bridge. So what happens is you can see these missing areas, right? So what you have to do is just, if you have a tooth in front of it and back of it, we can take support for those teeth. And like in this particular case, we can, shave the tooth in the front of it like this, it's called a tooth preparation, and abutment teeth here. So we do the same thing at the tooth in the back of it. So just go in there with a drill and shave the tooth at the back of it as well. So that way we recreate a little bit room for the crowns to go in the front of it and the back of it. So these two crowns will hold the missing crown in place. So it stays like this. So let me just show you one more time. So this is like a 3-unit bridge supporting it's a bridge supported by the front crown, teeth, and the back teeth, like front and the back teeth. So it just goes in here like this, and we glue it with the cement, or cement basically, right? So advantage about this is you do not have to wait for like 4 to 6 months like you normally do for the other implants to integrate. The other advantage is it's a little less cost, like, cost wise, it's a little cheaper or less expensive compared to the implant supported crown or bridge. And it's yeah, you don't have to wait, so that's another advantage. And it can be advantageous to the patient, especially some patients who cannot accept implants in their body. There are certain situations like medical conditions, if it doesn't allow, like this is a best option for them as well. And the other option is if you have like if you have a crown in the tooth in front, or if you need a crown in the front, a tooth in the front of it or the back of it. So this can be an easy solution. You just have to add another crown for the missing tooth. So that's the advantage. And the disadvantage is even though you have something on top, the bone loss will continue to happen at the cross section, the bone level. So that's that you have to be aware that the bone loss continues to happen, just not to the same degree as without, like, you don't have a missing teeth there. So that's another disadvantage. And if your teeth are healthy, the front and the back teeth, so it's not the best solution because you'll have to shape the teeth. So shape those teeth to support the middle crown. So you don't want to go that route. If you have the healthy teeth in front of it and back of it, you would rather just like shape one. You would rather just like screw one teeth and screw implant in one side and then replace that teeth. So that's that's the bridge, the dental bridge. So if you are not a good candidate for dental implants as well as the bridge, so the other options available are you can get something removable, or you can get something called esthetics retainer, which can hold the space for time being. And these are cheaper, but they're not the long-term solution, so that's something optional as well. So again, I know these are some of the educational some of the just the little things, how like how implants and bridges work in the body. So if you have any question, you can always share, and I can answer them for you. Or if you'd like me to talk about any other topic, you guys are welcome to ask me questions, and I can do that on my next Tooth Talk. So let me see if I have any questions. I'll wait for a few more seconds, and I think should be good. Well, thank you guys. Thanks for tuning in. I'll see you next week, and stay tuned for the update on the construction. I'll see you guys. I know I'll see you guys soon. And yes, and we are looking to open sometime soon, and hopefully we should be opening our VIP guest list pretty soon. So keep an eye on that, and that way, like, I can put you guys on my schedule as soon as it opens. Yeah, thank you. Thanks for tuning in. Bye bye. Have a good night.